In the Module 6, we would be looking at extreme weather events, their connection to the climate change in Asia and the Pacific, and the health risks they are likely to pose. The key messages of the Module 6 are: climate change is leading to changes in the frequency and intensity of many extreme weather and climatic events. Asia and the Pacific are particularly vulnerable to the impact of extreme events. There are a wide range of health risks associated with the climate extreme events in this region. Public health policies and disaster risk management initiatives can help increase the resilience to current and future health risks. This module presents a framework for considering the health risks associated with changes in the frequency and intensity of extreme weather and climatic events. The module summarizes the worldwide trends and hazards, the type of extreme weather and climatic events of importance in Asia and the Pacific, and how these events threaten public health, what are their sources of vulnerability, and the health impacts associated with these events. Disaster risk management and adaptation options would also be briefly discussed under the following 6 thematic areas. The first one is how to understand the health risks from extreme weather and climatic events. Second, worldwide trends and hazards. Third, extreme weather and climatic events in Asia and the Pacific. Fourth, sources of vulnerability to extreme weather events. Fifth, public health risk with extreme events. And sixth, and very important, disaster risk management. Let us start by looking at how to understand the health risk associated with the extreme weather and climatic events. The Intergovernmental Panel on Climate Change, that is IPCC, its special report on managing the risk of extreme weather and climatic events of advanced climate change adaptation, that is called SRX report, concluded that changing climate is leading to changes in frequency and intensity of many extreme weather and climatic events, and this report gave a special focus on Asia and the Pacific. The risk of extreme weather and climatic events depend on 3 factors: the nature and severity of the event to which a community is exposed, and the vulnerability of the exposed community and region. Because the extent of exposure and the underlying causes of vulnerability vary from place to place, the same strength event will have different consequences in different locations. Here, dear participants, I would also like to ask you your opinion whether the same intensity event can have a different level of impacts and damageability in different locations, and if so, what are the reasons? Thank you. Let us now look at some of the trends globally for how and where hazards are occurring. Munich Re collects data worldwide on catastrophes and disasters. Depending on their financial and human impact, events are assigned to one of the 6 loss categories, from a small scale loss event to a great natural catastrophe. The categories depend on the number of fatalities, how many were affected, such as being homeless, the extent of economic loss, and whether interregional or international assistance was necessary. Events are categorized as geographical, meteorological, for example, storms, hydrological, like floods, climatological, like extreme temperature, and extraterrestrial, like meteorites. This shows the 820 loss events in 2019. In comparison to the previous 2 decades, that was from 2000 to 2019, 2020 was higher than the annual average in terms of number of recorded events. A clear rise in the extreme events can be seen from the fact that in 2020 there were 26% more storms than the annual average of 102 events, 23% more floods than the average of 163 events. There were considerably fewer deaths compared to the annual average of 61,709 and fewer people directly affected compared to the annual average of 201.3 million people. The decrease in impacts is due to the absence of mass casualty events such as the 2004 Indian Ocean tsunami or high impact events such as the 2015 or 16 droughts in India. Apart from the COVID-19 pandemic, the year 2020 was dominated by climate-related disasters. These were largely responsible for the 389 recorded events, which resulted in 15,080 deaths, 98.4 million people affected, and economic losses of at least US dollar 171.3 billion. This table shows the top 10 natural disasters in 2020 by the number of deaths, 5 of which occurred in Asia, and here we see that India stands up in the top 3. These data are from the IPCC Special Report on Extreme Events. Over the period 1970 to 2008, over 95% of all natural disaster-related deaths occurred in the developing countries. It's highlighting their higher vulnerability because of, among other factors, poorer quality infrastructure, lack of urban planning, and early warning systems. This shows the trends in natural catastrophe worldwide from 1980 to 2015. The number of events increased over time, at least in part because of more people living in harm's way. Geophysical events, as shown in the red, have varied over time with no discernible trend. This is not the case for the other categories, all of which are associated with weather and climate events. Obviously, not all catastrophes are related to climate change, but meteorological, hydrological, and climatological events, the green, blue, and yellow bars, increase over the past more than 30 years period. The increases were largest for meteorological and hydrological events. One of the conclusions from the IPCC Special Report on Extreme Events is that the major cause of increasing damages from disasters is the increasing exposure of people and assets. More people and their resources are moving into harm's way. The example shown is the 2010 flooding in Pakistan that left more than 6 million people homeless. Many low and middle income countries have infrastructure that is vulnerable to extreme events. and thus increasing economic losses when an event occurs. The IPCC special report on extreme events found that the economic losses as a proportion of GDP from extreme events were highest in the middle income countries. As countries develop, their infrastructure becomes more valuable but may not have been adjusted for their designs and other parameters of resilience to withstand extremes. So, what have we seen from these graphs? Is this the general situation? Actually, what we have seen is not the general situation. We observed that more hazardous weather and climatic events are occurring now. We also observed that the low and middle income countries are particularly vulnerable. Asia and the Pacific is at more risk, and beside this, hazardous events are becoming more expensive. We have looked at the global picture. Now let us focus on the Asia and Pacific, our key area of interest as health professionals working in these regions. Countries in the Asia Pacific region with low-lying islands, extended coastal areas, mountains, and large river basins have a history of experiencing a wide range of extreme weather and climatic events, all of which could be affected by climate change. To expand some of these impacts, I have a question whether any one of you would like to respond to this. What examples have you seen in these events in your country or the region in the recent past? Any one of you? Any more? Thanks. So let us look at some of the data from the region now so that we can understand these kind of impacts taking place in our countries. These results from MDAT database show the reported deaths in Southeast Asia over the period 1970 to 2008 from the extreme weather events by country. This shows nearly 8 lakh reported deaths from extreme weather events. Storm mortality was by far the largest cause of death for extreme weather events at 84% of the total. Looking at the data from different countries, you can see that the impacts are not equally distributed by country or by the type of extreme event. This figure shows the rate of fatal injury rates per 1000 children in the age range of 0 to 17 years in Bangladesh, China, Philippines, Thailand, and Vietnam. As shown, the children under the age of 5 years are most at risk. More than 1,75,000 children and teenagers die from drowning each year. The main conclusions are the region has high vulnerability of extreme weather events. Children are particularly and differently vulnerable. Mortality impacts are not evenly distributed across the type of events or across the countries. even when differences in population are accounted for. And storms and floods account for the most of the majority of deaths from these extreme weather events. Now, this is a point of thought for the participants. Dear participants, this is a question to you, that what is your experience in your country with early warning systems? Are they being effective in preventing deaths or other health consequences of extreme events disasters? This figure shows disaster prone regions of Bangladesh by district, with cyclone prone regions in the mid purple color, flood prone regions in the dark purple, and rivers in blue. The box at the top shows major extreme events and their consequences, while the bottom box shows the issues and experiences in three major cyclones over the period 1970 and 2007, the innovations applied, and the actions after the event. The numbers in the upper right shows how these actions significantly reduce the mortality, thus highlighting that taking actions to prepare for and cope with extreme weather events can successfully reduce the mortality. Cyclones cause considerable impacts in the Southeast Asia region. These pie graphs show deaths over the period 1980 to 2009 as per the WHO CRO data. Just under half of all cyclones occur in the Western Pacific region, that is WPRO. However, more than half of the affected population and most of the deaths occurred in CRO countries, the light blue section of the pie diagram. The line graph below shows the number of events, the affected population in millions, and deaths in thousands from tropical cyclones. The very large number of deaths in cyclone Gorky are evident in the green spike in the bottom line. These images show the devastating effects that can result from cyclones. The first cyclone of 2008 season in the northern Indian Ocean hit Myanmar. The Category 4 cyclone killed more than 84,530 persons, and over 53,000 were reported missing. The average reported number of deaths per household was 2.2, with 66% of the victims being women. The most significant health needs was the support for psychosocial stress, where 23% of the people reported psychosocial problems after the cyclone. In the areas affected, two-thirds of the health facilities suffered some damage. 1 out of 5 was totally destroyed. Most were small, rural primary care centers. The estimated cost of rebuilding health facilities were estimated at US $2 billion. After the cyclone, 60% of the people had no access to clean water, as traditional sources of water in the villages became contaminated with seawater. In addition, many water sources became polluted due to the breakdown of the sanitation facilities in the flooded areas. A unique risk in the Himalayas is glacial lake outburst floods. As glaciers melt, the water collects in naturally occurring moraines. As they fill, the pressure of the water on the retaining walls can become too great, causing the walls to fail. Such glacial lake outburst floods have caused significant damage, with an increasing large number of lakes at risk. Smoke from agricultural and forest fire burning on Sumatra, shown in left, and Borneo, shown in right, in late September and early October 2006, blanketed a wide region with smoke that interrupted air and highway travels and also put the air quality to unhealthy levels. The image from NODIS on NASA's Aqua satellite on October 1st, 2006 shows where this MODIS detected the actively burning fires marked in red. Smoke spreads a grey-white pale on the north. As a result of these fires, air quality was degraded across the region, including in Thailand and Malaysia. So this kind of episodes also give an example on how extreme weather events can have an indirect health impact to the far off areas and can last quite long even when the event is already over. The Asia and Pacific regions have many cities located in the coastal areas and are vulnerable to sea level rise and to the associated increasing heights of the storm surges. As sea level rises, there is a non-linear increase in the storm surge. As shown earlier in worldwide disaster trends, storm surge is a major cause of impacts from the extreme events. I am sure many of you are experiencing that Asia and the Pacific is facing an increasing trend of extreme weather events. The frequency, intensity, and duration of these events are being altered by the impact of climate change. In order to manage the risks, we need to understand what makes individuals and communities and also their resources and assets vulnerable to the impact of climate change and how these vulnerabilities interact with extreme weather and climatic events. A wide range of factors affect individual vulnerability to an extreme climatic events. For example, older adults and young children are often less able to manage extremes. Those with chronic medical conditions, such as diabetes, are more susceptible to the impact of extreme weather. Those with low levels of physical fitness or mobility, those with physical or mental impairment. Social isolation is also associated with increased risk during the heat waves, and poverty is associated with increased morbidity and mortality from all extreme climatic events. This slide further emphasizes the importance of understanding vulnerability. One of the key conclusions of the IPCC's special report on extremes was that it doesn't take an extreme weather and extreme events to create an extreme impact. The example is from Zimbabwe, which has very high vulnerability because of a weak health system, limited investment in public health infrastructure, particularly sanitation, and other allied factors. By the end of November 2008, three of the Zimbabwe's four major hospitals had to shut down, along with the Zimbabwe's medical school. The fourth major hospital has two wards and no working operating theatre. The urban water supply, sanitation, and garbage collection system had collapsed. Due to the economic crisis, most households could not afford fuel to boil water. In August 2008, cholera was introduced. Africa's largest cholera outbreak started following the onset of its seasonal rains, with over 90,000 people affected and more than 4,000 deaths. In February 2009, approximately 8,000 cases were reported weekly. Cholera is spread to Botswana, Mozambique, and Zambia. The outbreak was contained in mid 2009. Now let us look at the health risk of extreme weather and climatic events. Let us look at the public health impacts of extreme weather and climatic events. Direct health impacts of an extreme event are those that arise from the event itself. For example, the drowning from a cyclone. These impacts typically provide the information that is subsequently used to describe an event. For example, so many dead or so many hospitalized. Mental health impacts of extreme weather events are increasingly being recognized as significant. In the categories of direct health impacts, there is often delayed onset to mental health impacts. These can have long-lasting effects on productivity and quality of life. Indirect health impacts arise from the interaction of the extreme events with other factors, such as water supply system, or from secondary effects, such as breeding of vector-borne diseases in pools of water created by floodwaters. Indirect impacts generally occur after the event. Understanding these indirect impacts is important for ensuring health systems are prepared to conduct surveillance and monitoring, and for ensuring that healthcare workers have the necessary training and that adequate supplies are available. This slide again highlights that climate change based projections of the magnitude and patterns of future extreme events are only part of the information needed to estimate how health risks could change with changing weather patterns. Development pathways will be a strong determinant of future risks. Population growth and age distribution are easier to project than other important factors such as the health status. Because the poor bear a disproportionate share of health impact, considering how economic growth and inequity might evolve other important considerations, as are the number and distribution of low-income population. Improving the quality of life of the poor can provide health benefits. The role of adaptation must be considered when predicting future health risks. After discussing the aspects of vulnerability, now let us discuss various aspects of disaster risk management with reference to extreme weather and climatic events. When planning for how to increase resilience to extreme weather and climatic events, an important consideration is that effective risk management and adaptation options are designed and implemented taking into consideration the unique vulnerabilities and exposure of hazards of each region. In some situations, the most important policies and measures are those that reduce vulnerability instead of focusing on extreme weather and climate events. So, in overview, we agree that developing effective adapting responses for extreme weather events require understanding of the nature of the health risk, who is particularly vulnerable, and the options for increasing resilience to risks. Planning should include local or national disaster risk management committees, non-governmental organizations and other resources such as various authorities and agencies at national, state, districts and the local levels, academic institutions having suitable experts to deal with these disciplines, research institutions, or other key stakeholders including the private sector. Having experience, expertise, and interest in the area of increasing resilience to extreme events. Creating hypothetical scenarios and holding drills can also help develop the network and teamwork that is needed to manage an event effectively. Goals for extreme weather event notification and response plan, therefore, would include the coordination of health system responses with national disaster risk management committees and agencies, developing hypothetical scenarios and practices, draw upon the lessons of the past experiences, and to be open to outside assistance that has potential to improve public health as per the national, state, or local disaster management frameworks. So let us summarize what did we cover in the Module 6. We discuss on how to understand the health risks from extreme weather and climatic events. We had a look at the worldwide trends of the hazards, then extreme weather and climatic events in the Asia and the Pacific, sources of vulnerability to extreme weather events, and public health risk with extreme events, and finally, the disaster risk management aspects. So the learning from Module 6 include the conclusion that extreme weather events already present a significant health risk to countries in the Southeast Asia region and the Western Pacific region. Climate change is increasing the frequency and the severity of many extreme weather and climatic events such as storms, flooding, wildfires, and many others. So the important recognition is on the aspects that how the health risk of extreme events could change the uncertainty levels under the impact of climate change. So the changes in factors other than climate change will be critical in determining the nature and extent of the future risks. However, uncertainty is not a reason to not take the action. Effective preparation can significantly reduce current and future risks under the climate change. Dear participants, after going through the Module 6, I would like that some of you or all of you undertake some specific action based on the learnings of this module. I would ask you to spend next few minutes over your notes and reflecting the key learnings from this module for you, and also to see how the actions at your work after this training is over, you would take the benefit and advantage of this training module and its learning. So after this, the next module would be on disaster risk management, that is module 15.